In June of 1985, there were 50 cases of the mysterious thyroid outbreak concentrated in two nearby towns, Laverne, Minnesota, and Valley Springs, South Dakota. The Centers for Disease Control in Atlanta was called in to investigate.
Certainly one of the most puzzling things about the outbreak is we didn't know what it was due to, and this made it incredibly difficult. Was it in the air? Was it in the water? Was it in the food? There was just no way to know.
We were concerned that this might be a new disease, that might be a new virus that we didn't know anything about, and that we needed to respond rapidly, to identify the magnitude of it, to identify the etiology, to determine if this was going to be something we were going to we would face as an ongoing problem and maybe a problem in other parts of the country.
Investigators needed to know as much about the outbreak as possible. It was striking both men and women equally. All age groups were affected. There appeared to be no occupational association and no worksite or school clusters. Entire families were affected. Was it possible that the outbreak was being spread person to person? Everyone suspected of having the disease was given a blood test and interviewed about where or how they might have contracted it.
You talk to patients, and you hope that by doing unstructured interviews, you'll get some ideas.
One of the questions that I thought was kind of cute that the epidemiologist asked everybody was, what do you think causes this? And the most frequent response, there had been a lot of tornadoes in this area the year before. The most frequent response was, I guess those tornadoes stirred up some chemicals and that got into our water supply.
But in order to determine what was causing the outbreak, investigators first had to figure out what the problem was. Blood tests revealed that all of the victims had an excess of thyroid hormone in their system. In some cases, the levels were 8 and 10 times above normal. Tests of the drinking water did not reveal anything which could have caused the outbreak. Dr. Louis Braverman is the country's leading expert in thyroid diseases. He was asked to examine some of the sick patients in South Dakota.
We then went out to a small community called Beaver Creek, if I recall, and went into one household where there were 4 generations in the house who had all of the signs and symptoms of thyrotoxicosis, and none of them, from a 4-year-old child to an 85 or 90-year-old great-grandfather, had an enlarged thyroid.
Since the thyroid glands of these victims weren't enlarged, they had no idea what was causing these symptoms. In the past, enlarged thyroid glands were so common in this part of the country it was known as the goiter belt. A goiter is the term for an enlarged thyroid.